Here's a bold truth. Florida's healthcare landscape is evolving rapidly, and staying informed about the latest news and policy shifts is more crucial than ever. Welcome to Diagnosis, your go-to update that dives deep into the dynamic intersection of healthcare policy and politics in the Sunshine State. Florida's hospice care, a national trailblazer. Florida continues to set the standard in hospice care, ranking proudly among the top 10 states nationwide. According to the newest figures from the Centers for Medicare and Medicaid Services, Florida's hospice services stand out, and Florida Tax Watch credits much of this success to the state's Certificate of Need (CON) program. This program carefully controls the expansion of hospice services to ensure quality remains high and care is sustainable. Florida's impressive performance includes a 6th-place ranking in the Hospice and Palliative Care Composite Process Measure, scoring 95.9%, and a tie for 2nd place in the overall Hospice Care Index with a score of 9.7. Dominic Calabro, President and CEO of Florida Tax Watch, emphasizes how palliative care, when introduced early in a patient's disease management, not only enhances quality of life, but also cuts costs for both families and taxpayers. Jeff Kottkamp, Executive Vice President of Florida Tax Watch, points out a significant challenge. Despite these achievements, more than half of Florida's counties lack adequate access to palliative care. This gap underscores the vital need to keep the CON program intact, which the group argues safeguards care quality and curbs fraudulent practices. This recent report, titled Hospice and Palliative Care, Florida is a national leader among the states looked to for best practices in compassionate care, highlights a noticeable trend toward community and home-based palliative services. These services not only improve patient satisfaction by allowing care in familiar environments, but also reduce expenses. But here's where it gets controversial. The report suggests a stronger regulatory framework is necessary to clearly define palliative care, establish standards, and secure funding channels. Florida Tax Watch also advocates for expanding the scope of advanced practice registered nurses, launching Medicaid pilot programs that encourage earlier hospice transitions, and fiercely guarding the CON program. Why? Because removing this oversight could invite an influx of lower-quality providers, a pattern already observed in states without such controls. Nursing shortages loom large in Florida. The Florida Center for Nursing, FCN, at the University of South Florida has just published a comprehensive workforce forecast through 2037, and the news is concerning, especially for nursing professionals. Their Florida Workforce Projections 2022 to 2037 report projects supply and demand trends for a broad range of healthcare roles, including physicians, advanced practice providers, nurses, allied health workers, and nursing assistants, using advanced data modeling. One of the most critical takeaways, licensed practical nurses, LPNs, are headed for a sharp shortage, with supply expected to shrink by almost 1% annually, while demand grows by 2.3% per year. This mismatch could reduce service adequacy from 85% in 2022 to a worrying 55% by 2037. Registered nurses, RNs, on the other hand, might hold near balance statewide at 93% adequacy. But regional disparities will still create localized shortages. The outlook for certified nursing assistants is particularly stark. After years of surplus, shortages could emerge as soon as 2026, becoming severe by 2037. Reina Letourneau, FCN's executive director, highlights why these numbers matter, especially when considering regional differences. She explains, even if statewide figures look balanced, many areas face very different realities. Recognizing these gaps is vital for effectively supporting and expanding the healthcare workforce across all corners of Florida. Usha Menon, Senior Associate Vice President at USF Health and Dean of the USF College of Nursing, adds that such insights are invaluable for tailoring educational programs to meet Florida's most urgent healthcare workforce demands. With Florida's booming population and the growing number of older adults, FCN emphasizes that these projections should shape future education, training, and recruitment strategies. Quick hits you might have missed. AdventHealth is set to develop an emergency room facility at Wild Oaks, located near SR 429 Exit 38 and W. Kelly Park Road, beside a public park and nature preserve. Announced during the ICSC at Florida conference, the collaboration aims to blend quality healthcare with the community's values. Wild Oaks founder Joseph Beninati expressed enthusiasm about the partnership, highlighting shared conservative financial principles. This advanced ER could eventually expand into a full hospital. AdventHealth, recognized by U.S. News World Report as the top hospital in Florida and among the nation's 20 best, operates 17 hospitals and numerous outpatient centers. Tampa General Hospital's TGH Transplant Institute earned national recognition as the #1 transplant center by volume in 2024, completing 889 transplants. This achievement covers adult kidney, liver, heart, lung, pancreas, and pediatric kidney transplants, making TGH one of the few hospitals offering all 5 major solid organ transplants in adults. Why does volume matter? Because higher procedure numbers correlate with better patient outcomes, shorter wait times, improved survival rates, and ultimately more lives saved. New regulatory moves. Several new rules are taking effect or have been proposed recently. A new proposed rule, 59A346, detailing standards for licensed programs within hospitals, was published on September 8th. The Department of Health Board of Chiropractic Medicine's final rule concerning licensure endorsement applications comes into force on September 15th. The Department of Health Board of Opticianry implemented a final rule on apprenticeship and training program requirements as of September 9th. Mark your calendars, September 15th. A big happy birthday to Representative Mike Caruso. September 22nd, warm birthday wishes to Senator Jennifer Bradley. September 25th, celebrating Rep. Michelle Rayner's birthday. And here's the part most people miss. These birthdays remind us that personalities and politics are intertwined with policy progress. How might these lawmakers influence Florida's healthcare future? What role should they play in addressing the nursing shortages or regulating hospice care quality? We invite you to share your thoughts. Do you agree with preserving regulatory programs like the CON to maintain care standards? Or do you believe deregulation might foster innovation and competition? The debate is wide open, and your voice matters.